Welcome everyone. The big question that I'm often asked is, do vitamins really improve your health? Well, it's a great question, and there are tons of information on the subject, and there are some studies that don't quite highlight the benefit of vitamins. When we were in medical school, and that was a while ago, in the late 90s, and now my son has just finished medical school in Jackson, Mississippi, and really the teachings about vitamins really hasn't changed. We get 1 day of nutrition and 1 day of vitamins in the whole 4-year curriculum. So, nonetheless to say, it's not taught, so it's not something that a doctor, even though we're well versed on all kind of disease states and disorder states, and we're very great at acute disorders, meaning sinusitis, pneumonias, and so on and so forth, we're not always so well trained on, well, are there something that's simple that could prevent some of these disorders? So tonight, I'd like to introduce that topic to you and show you and tell you about a few things that we now know vitamins do in fact improve our health. Hi, I'm Dr. Kelly Burkenstock, owner of Skin Body Health in Mandeville, Louisiana and New Orleans, Louisiana. We're also licensed in Alabama and Florida, where you'll see me come to town and do conferences, beauty, anti-aging shows, Botox events, and the like. We also teach a lot about men's male health as they get older in andropause, and female health as they get older in menopause. We have a lot of procedures to maintain or restore male health in the penile organs and female health in the female organs, as well as just general female and male hormones that make them feel better. We have a huge weight loss program, so we're a sort of a full continental anti-aging center, and we love and respect our patients, and we are so thrilled to come on to our webinars and to give you information that can solidify and improve your health. So before you get ill, just like with your car, before your car breaks down, you're going to change the oil, you're going to certainly keep it filled up with gas, you're going to change the water and the air filters and all those other things to maintain a car so that it doesn't break down unnecessarily. Unfortunately, we don't often do that with our own bodies, but we should. So there is a doctor, he actually did a TED Talk. I'll get his name placed up on the screen. And he did a TED Talk, and his son went to the hospital as a young man, and he went into a coma. The doctors did a lumbar puncture, which is in the spinal cord. They did all kind of blood testing and MRIs and CAT scans and couldn't figure out why the child was in a coma. He finally came out of it after 3 days. Well, what the blood work showed later down the line was that he had a severe low calcium and low vitamin D deficiency. Calcium and vitamin D deficiencies put this child in a coma. He's a medical doctor's son, and there was nothing else wrong with him. Of course, though, he didn't know that. So that is what put this doctor onto a lifelong journey of studying vitamins and beginning an anti-aging practice and giving up his normal taking care of disorder problems as a general practitioner. I'm so sorry his name has skipped my mind, but I will get that up before the end of the seminar. It's in my history. So, life learning lesson. Deficiencies can cause major problems even in young children. So, as an adult, what should we do? Well, do any of us totally eliminate processed foods, fried foods, YouTube, a history, fried foods, processed foods, ice creams, cakes, candies, chips? Are there any of us, are we totally clean in our diet? Most of us would have to say no. Of course, there are some wonderful team players out there that are totally clean, but by and large, the variety and the majority of the population don't eat that clean. So when that happens, we get all of these disaster-causing, non-nutritive foods into our system, and they cause havoc. They cause free radicals and oxidation, which increase aging and causes breakdown of organs. So if you're just wanting basic, what can I do, where do I start, I would totally recommend Vitality, which is our jam-packed multivitamin and multi-mineral and probiotics. Because when the gut is a leaky gut, you're not absorbing any vitamins and minerals, and you can get sicker quicker. And the gut is related to the brain and the skin. The gut actually has brain receptors in it. So if you're just starting out on your vitamin path, my solid recommendation, and this is the bundle that we're offering today, would be Vitality, our general vitamin and mineral, as well as probiotics to tighten that leaky gut. What makes a gut leaky? Stress, medications, even something as simple as Tylenol or an antibiotic, or bad processed foods, xenoestrogens and estrogens in the environment, xenoestrogens in all of the fast foods. It definitely is there. That's why we're seeing so much male infertility, women infertility, and male having testosterone and erectile dysfunction way earlier in life. Females going through menopause or menstrual irregularities very early in life. It's because of all of these xenoestrogens and the pollution in our processed foods, in our fast food chains. So what if you were a client of mine and you had a specific disorder? Well, tonight, Todd's going to come on in just a moment, and he is a patient that has been in my clinic many years. He has a couple of mild disordered states. We have him on a custom program of vitamins and minerals that address some of his main problems. We're going to show you by his blood work. Do vitamins work or don't they? One thing I must make sure that I do say is there are quality vitamins with high potency, and there are also sort of vitamins in every store, in every drugstore, in every pharmacy, and GNCs and vitamin stores, and the FDA has been cracking down because it's considered a food. What's on the label doesn't necessarily have to be in the jar as long as they don't hurt you. As long as they don't hurt you. So they could be calcium or just chalk or some other filler in there that does not exemplify what's on the label. If you've got a GMP approved vitamin, that GMP approved vitamin is going to have exactly in each capsule or tablet what is on the label, because it's an FDA requirement. So you want to look for the symbol GMP on your labels to make sure you're getting a quality, potent vitamin. They're usually not any more expensive than the junk out there, but at least you're getting what you thought you were. And that doctor's name that did the TED Talk about his son was Dr. Brad Stanfield. Dr. Brad Stanfield. Google him on YouTube. It's a very interesting, short, 15-minute TED Talk, and he tells the whole story about his son and how that changed his practice from a practice of treating diseases, diabetes, blood pressure, and the like, to a practice of backing up those disease states with vitamins, mineral, lifestyle, and food recommendations. So my client tonight that will be on shortly is Todd. And on Todd, we'll have these his blood work to show you. If we go back to his blood work from October of 2021, his hemoglobin A1C was a 9.9. So that is a pretty high sugar. We want to get it down in the 5s, and we're working towards that goal. But since Todd and I have been working on this from 10 of 21 to now, we've gone from a 9.9 to an 8.8, absolutely no insulin. We've got him on some good diabetic medications, and we're continuing to work on lifestyle changes. And in addition to that, I've started him on 4 of my products: Sugar Smart, Chromium Calm, and R-Lipoic. So Sugar Smart, Chromium Calm, and R-Lipoic are all in there decreasing his insulin resistance, which is one of the things that aggravates high sugars and diabetes, and blocking some of the sugar absorption in a very, very natural way, just with vitamins and herbs. So we're using that and combating it to combat those high sugar levels without taking that plunge into insulin, which is a plunge that we don't ever want to take unless we absolutely have to. The other thing we are addressing with Todd's blood work is his inflammation. So inflammation is going to increase that insulin resistance, aggravate that diabetic state, and continue to injure the organs just like sugar injures our organs and can set us up for heart attack and stroke. Uric acid can also cause gout when at a very high level. So in October of 2021, again, his uric acid was a 6.3, and now today it's a 5.9. How did we do that? With 1 ounce of tart cherry juice at night, and the fourth product that I have him on, which is Uric Balance. So there we go, without using strong medications, we were able to get his uric acid down 4 points from a 6.3 to a 5.9. And just of note, 5.9 and below is a normal uric acid range. So we're able to help this gentleman with vitamins, herbs, and 100% tart cherry juice, and not have to fight yet another strong prescription that could possibly harm the body in other ways. Of course, we always need, when things get severe, we may need to err on a prescription, but we always want to try herbs, vitamins, and good foods first. Cinnamon. Cinnamon is a wonderful additive for anyone who's got sugar issues. You can put cinnamons in yogurts, oatmeals, teas, coffees, whatever. And cinnamon is a natural sugar cleanser for the body. So when we're talking to any patient, especially a patient like Todd, we're going to tell them to eat the colorful foods. The colorful foods have the phytonutrients, the antioxidants, and all of the natural food fighting power that's going to help our bodies stay healthy and intact. So the colorful foods: red bell peppers, red apples, yellow bell peppers, oranges, purple eggplants, purple plums, green cucumbers, spinach, kale, and the like. Another one I want to mention, because it gets a bad sour name and reputation, but it's really a wonderful food, and it's the incredible edible egg. I do recommend eggs. Please don't fry them if you can help it. And with eggs, there is so much protein and albumin in the yolk. Don't give up the yolk. That became popular for a while, but you need the whole egg. Boiled is best, but scrambled isn't the most horrible. Just use a tiny bit amount of virgin olive oil. But it would be best if you boiled your eggs. You're going to get so much benefit from them because they do contain a little bit of the bad cholesterol as well, but immensely more beneficial ingredients in the yolk. I would definitely recommend taking them in the morning, so that as the evening and the afternoon goes, you've walked off the bad cholesterol, but the good cholesterol, the albumin and the protein and the immune fighting is in your system. Okay, so without further ado, we'll bring on Todd. Hello, Todd. Welcome this evening. How are you?
Wonderful, thank you.
Good. So, Todd, we've been working diligently since October of 21 to get his sugars down. We've used a couple medications, but now we're saying, what else, what benefit can we get from vitamins and good foods that could tilt that sugar down without going to that stage of insulin? So, Todd?
Absolutely. We've had worked on this problem for quite a long time. As a small business owner, you know, stress, skipping meals, problems, we have them every day. We go 800 miles an hour, never catch up. But since I've been taking the supplements and the additions to what we were doing, I feel better. I can move all day long without getting tired in the afternoon, without having other problems, and it's all because of the vitamins that we've been working with here lately.
Great. Well, I thank you for that. And I was so surprised with the Uric Balance and the 100% tart cherry juice, because Todd didn't want to add on another supplement. But once he saw the figures, once he saw the changes in the blood work, he said, I'm definitely committed. Yeah?
Absolutely.
Yeah. When you can bring down something with nature, 100% tart cherry juice, and a little uric acid supplement made from herbs and minerals. In our brand, Skin Body Health, that's what we've been doing, and the blood work tells the story. Thank you so much, Todd, for coming on today. We certainly enjoy having you.
Thank you.
So, they're not going to have, at least at this point in time, a lot of those wonderful studies that we like to see. Because of course the FDA makes us do double-blind control cohort studies when you're trying to get a medication approved. Well, when Big Pharma is investing millions in a drug, they're going to go through all the studies because they want that drug approved, and it's going to come to the market at a very high price. Well, as vitamin manufacturers in our facility, no one facility or even groups of facilities have those kinds of millions of dollars to start a lot of these different double-blind and controlled studies. However, to me, we can back into this, and there are some newer studies out there now, there really are. But when we can see it in someone's blood work, we absolutely know we're doing the right thing because the sugar's going down, so you know the heart damage, the eye damage, the feet damage, the nerve damage, the kidney damage is being decreased, slowed, and hopefully halted. When the uric acid is down, we know we're not going to get those gouty joints from that increased uric acid. Uric acid also contributes to heart attacks and strokes. It's sort of shaped very similar to a cholesterol particle. So by keeping that inflammation down, the body is healthier, happier, the immune system goes up, and you're getting a lot of wonderful antioxidants. Another client I'd like to discuss tonight is my son Blaze. So when we looked at his vitamins, I was pretty surprised. So his vitamin D was at a 27. And of course, we have a goal of 85 to 100. When you bring up your vitamin D to those 85 to 100 levels, you're really improving your immune system, you're improving any depression or tendency for depression, bone health, heart health, so many other things. Vitamin D is really hormone D. We don't think they'll ever rename it, but they found out that vitamin D has a much, much bigger role than just vitamin D. It's actually part of the hormone cascade, and those hormones play off one another and they create an orchestra, and that orchestra helps the whole body of hormones sing. So we're going to bring Blaze up in a moment. When we're looking at his blood work, he had high cholesterol, and that runs in his father's side of the family. My side of the family as well, although I don't have high cholesterol. And we certainly didn't want to start any medication in a young person. So we tightened up his college diet, and what we started was Omega Pure, which is an omega fish oil. And omega fish oils can be as bad as motor oil if they don't have high EPA levels. So EPA is the driver of the fish oil that goes inside, improves symptoms of ADD, brings down bad triglyceride cholesterol, brings up good HDL cholesterol, and makes that sticky LDL more slippery so it's less dangerous. So it's a total win on all counts. Vitamin D drops. As you notice, you can get vitamin D at the grocery stores or pharmacies, and the bottles will say, this caplet's 10,000 units, this caplet's 50,000 units. Well, if they've got to use 10,000, 50,000 of anything, that probably tells you it's not absorbable, because why do they have to use so many thousands of units to get it to stick, if it even does? So when I used to, before we had our vitamin brand manufactured, I would put people on vitamins and I'd scratch my head because I would know how vitamins improve health and work, and the vitamins I was taking and how much my own life changed. That's when I learned all vitamins aren't the same. If they've got a check mark or a squiggly or it says we guarantee, none of those are an FDA approved vitamin. That's just a little check mark or symbol they're putting on the bottle. Often to try to look alike to the GMP FDA approved symbol, G All of our vitamins are GMP approved. There are some other great ones out there as well. Just make sure your vitamin has GMP. So our vitamin D is in liquid form. It's little drops, and you just place them on your tongue. It's absorbed immediately. And Blaze's vitamin D went from a 27 to 141, and we actually had to back off because it went so high so quickly. So let's see. Yeah, September 16th of 2021, his vitamin D was 146, and which was a huge difference from where we started out at the 27 a couple of years before. Blaze's uric acid was also very high. We put him on uric balance and 100% tart cherry juice. The last items we put him on, as I said, was Omega Pure for the cholesterol, CoQ ubiquinol, which extends life because it increases your telomeres on your mitochondria. That's proven. Wonderful, wonderful anti-aging tablet, also very good for cholesterol. And last but not least, Ionato. This isn't your regular vitamin E that you see on the shelves in the grocery store. Those are tocopherol E. Tocopherol E has very mixed studies and in some patients can be harmful. This is tocotrienol E, tocotrienol. It comes from the Ionato plant in Brazil, and Ionato is from those plants in Brazil. That's where they grow. So without further ado, I'm going to bring Blaze up. Okay, so Blaze, when you started, when was it that your vitamin D was a 27?
So I just moved back in town from college in 2019 in November, and I wasn't feeling the best. I'll be honest, I was a little tired all day long, no matter how much sleep I got, and yeah, I started taking some vitamin D, and on top of that, my vitamin B's were a little low too. And from Dr. Burkenstock, the D Pure right here actually is what I use. Just take about 10 drops every morning. Started feeling it within about a week. I started feeling great, had my energy levels back, and it really helped me focus, and I even stopped taking my Adderall because it was just giving me a little bit too much stimulation. So.
Yeah. And then you also do it in combination with Omega Pure. So I don't want to say it was just the vitamin D, but the vitamin D in combination with the Omega Pure, it's just a home run for anybody who's got ADD, ADHD. It may not get you off your medicine, but it will certainly improve thought, concentration, and focus in a way more natural way. Perhaps you can take less medication or probably none at all. But of course, never stop taking your medication without consulting your particular doctor. And the CoQ and the Ionato E got his cholesterol, his LDL down from 140 down to the 90s. So it's just been a home run for him as well. And that's the main things we want to talk about vitamins today. Do we believe in them? Absolutely. Do they work? Yes. How do we know? We watch the blood work. And we can show you client after client, patient after patient, when before and after blood works are totally improved. They feel better, they look better, their skin tone is better, and they say, you know what, I'm not getting sick as often, because vitamin D also very, very much improves the immune system. So when we're checking our normal blood panels, we also add in vitamin panels so that we can see if there's a deficiency. We also look at minerals, magnesium, calcium, zinc, etc. And when we identify a deficiency, we have a product that can correct it without going to big medications. And when we do that, we actually prevent the disease processes from forming, and that's what it's all about. So, pleasure talking with you today. I'm Dr. Burkenstock from Skin Body Health, and that's your anti-aging vitamin information for today. Tune in to us again on Tuesdays. It's always our pleasure serving you. Don't forget to like and share our webinar. If you do, we're giving away a free bottle of our Vitality for the first 10 people that like, and don't forget to hit share our video webinar today. Our YouTube channel, Dr. Burkenstock Skin Body Health. We've been talking to you guys for years. If you missed anything, or if you want to go back and revisit one about Botox or Brotox for men, or male hormones, female hormones, any of our procedures, vitamins, anti-aging, please feel free to do so at YouTube channel, Dr. Burkenstock Skin Body Health. We can also be found on TikTok and Instagram. So as always, a pleasure visiting with you tonight. We'll see you soon.